So Maggie and I decided to look into the research behind using the Nintendo Wii Fit on post-stroke patients. This works well with our patient currently because our patient is named Al. He is a 42-year-old male, and he is currently recovering from a ischemic stroke on his right MCA. And this stroke occurred 3 years ago. So he's currently still ambulating with a left AFO, and he uses a straight cane on the right to help with his balance when walking. His impairments are currently left-sided neglect, left hemiparesis, impaired coordination on the left, impaired balance, decreased stepping strategies, and increased tone on the left, particularly in his upper extremity. And he's currently struggling with his ability to weight shift in all directions without the loss of balance, particularly shifting over towards his strong side when picking up his left side to take a step. Therefore, he's showing difficulty initiating proper stepping strategy in response to perturbations.
So something that we decided to implement recently with Al is the Wii Fit. And so it's kind of a fun way to do therapy, but it also encourages proper postural control during balance, stepping strategies, upper extremity motor function when you're holding on to that remote, decision-making, and then reactive and anticipatory balance. And so all of these things are things that he needs to improve on. And it also adds a cognitive component as well, which is a great benefit to him. And so this would work for Al really well because he wants to increase his ability to do ADLs on his own. And those ADLs require that postural control, stepping, motor function, balance, and even that upper extremity motor function a lot of the time. Al also states that sometimes he has a little bit of mental fog or delay. And while that's getting better, the cognitive component of the Wii can really help with this, with the decision-making, perception, sustained attention, that kind of thing. And then as Aliese mentioned, he also does have left-sided neglect. And so this is a really good intervention to do because he has to pay attention to the left side of the screen in order to complete the games appropriately. And so the article that we chose to do this project on is called The Effects of Nintendo Wii-Based Balance and Upper Extremity Training on Activities of Daily Living and Quality of Life in Patients with Subacute Stroke, a Randomized Control Study. So this was a randomized control trial, so it's level 2 evidence. And it looked at the analysis between using the Nintendo Wii and quote unquote conventional therapy like NDT, and that effect on upper extremity function and quality of life. So both groups received training for 10 weeks. The Nintendo Wii group exclusively trained only on the Wii with a series of 5 different games that included the balance board and the hand controls. And the NDT group obviously received NDT training, but they also had other training, including scapular mobilization, lat stretching, balance, weight shifting, gait training. So they had more therapy and more techniques in addition to the NDT.
So the results of the study showed that the Nintendo Wii can be just as effective as using NDT for stroke patients. There was a non-statistically significant difference on gaining independence in ADLs and improving quality of life, but there was still a increase in both of those scores when using the Wii Fit. The scores being the functional independence measure, the FIM, and the quality of life measures. So these results justify our use of the Wii Fit with Al. We used it last week with him, and it actually worked really well. He seemed to enjoy it. And we're going to continue to use it in addition to other therapies such as NDT to ensure a well-rounded plan of care and produce the best outcomes to reach Al's goals.
And then just some limitations of the study and things to consider for us as we treat Al with this technique. There was no control group that was present since they just had the Wii group and the NDT group, so we can't really see the effect of a control group. Additionally, it was only done over a 10-week period, and so the long-term effects weren't really analyzed with this study particularly. The authors state that there was a little bit of inadequacy with the outcome measures that they used, and then they did only select 5 different Wii Fit games, and there are a whole slew of others. So they really concluded that further randomized control trials are needed to investigate the influence that these games can have on physical function and quality of life when compared to other treatments.
That is it.